Good morning, everybody. My name is Luis Roman. I am with the Association of Latinos, Latinas Motivating Action. It's an LGBT Latino group in Chicago, and we're trying to do more advocacy work moving forward. Homelessness is a big issue in our community, and so just a really quick shameless plug, our next campaign is going to be on family acceptance. Recently, the HRC and LULAC, the League of United Latin American Citizens, published a report on LGBT Latino youth, and the biggest concern for Latino youth was families, and wanting to have someone that they can relate, that they can talk to in their families. And so we're gathering a bunch of Latino serving agencies throughout the city to work forward on our family acceptance project. And so there's a lot of health that we talked about because the youth and the service providers acknowledge that health is not just access to healthcare, but really a holistic approach to these issues. To summarize it, our group came up with an acronym, RAP, representation, access, and proximity. So that's the end of my session. RAP. So we're going to begin. So access to county care, so remove barriers to enrollment and get youth enrolled. And so there was a lot of folks from the suburbs as well, so it's not just Cook County, but how do we get folks outside of the city and the county to really move forward and get folks applying to county care and other access to health care. A big issue that the youth had is that in the shelters or in the services, they encourage people to apply, but oftentimes they didn't hold their hands and apply with them or for them. And so it was one thing to tell them, here are the resources, go find them, and it's another thing to go with them and do it with them. So access, provide summertime access to healthcare, including counselors. A lot of the youth who are still in schools, when school's over for the summer, they don't have access to any of the medical needs, specifically mental care. And the other was, as someone mentioned, right, this is about families. And so when you are a family, you are living in a shelter, what do you do with your kids when you have to go to the emergency room or go to your checkup? Oftentimes in these shelters, they require you to do chores, and you have other responsibilities that if you don't meet, then you get kicked out of the shelter. So then what are you doing to kind of make it more family inclusive and making sure that all the family members' responsibilities are met? And Transgender Health. So the biggest issue is that for a lot of these agencies are not providing the full scope of services that transgender individuals need. So making sure that LGBT healthcare institutions have the staff that can meet all their needs for the individuals, supporting healthcare facilities to provide medically appropriate subsidies, hormones, and supportive supplies, and encouraging the Howard Brown Health Center to not only be more expanded services, but also market itself to really, for the rest of the community, so they can have access to them as well. And add mobile pop-up clinics for transgender health needs throughout the city. The thing that we heard a lot was that people were tired of coming to the north side to get these services. People from the west side, from the south side, and also people from the suburbs, they're tired of sending youth to the north side on the metro, on the CTA to come get these services that they should be able to get in their local communities. Education. Communicate what health programs are available to homeless youth. A lot of the youth mentioned that there's all these services available to them, but oftentimes they're not centralized, or all these resources are not centralized. So oftentimes there's a lot of referrals that are made. So when youth have to travel from one place to the other place to the other place just to get their questions answered. So there's a way that we can centralize all this information, whether it be a booklet, whether it be just having a staff person in these agencies that are aware of all the services. They would really appreciate that. Also train medical staff and make sure that they are trauma informed. Specifically, a lot of the youth were, one of the big issues, and Elsie mentioned, is representation. Youth want to see and talk to folks that look like them and have experienced similar things such that they're going through. When they're going to go see a doctor or another provider, oftentimes providers are not sensitive to their needs and to the issues that they're going through at the moment. And so they either feel completely uncomfortable, they shut down, and did not disclose all of the issues that they're going through for that reason. On college campuses, for example, they need more culturally competent medical care, including psychiatric. I know the UI system has recently expanded to include some transgender health needs, But again, there were a lot of students who were these past few days who, even though the services are now supposedly being provided to them, all of them didn't know who to turn to for these services, and there was no one to really advocate as to the follow-up now that the UI has changed their policies. And again, train nurses in the K-12 system, not just in CPS, but also throughout the state, to make sure they're being culturally competent caregivers. So not just referrals, but also providing them with some of the more nurturing facets that they may need. And then again, working with CPS and other school systems to ensure that healthcare providers, both being nurses but also counselors, are they're being trained, but also have their follow-up afterwards to making sure that the nurses and the providers are doing what they're supposed to be doing with the youth. Hospitals. So recently, the Human Rights Campaign came up with an evaluation of hospitals throughout the country, and so I believe the issue that a lot of us had was that we didn't know that this evaluation existed, and if we don't even know, the youth also didn't know, so they didn't really know who to turn to and which hospitals to go to, and even if those hospitals did exist, were they taking the youth that we're working with, right? So a lot of these hospitals are privately owned, or they only take insurance, and so the youth here most of them did not have insurance. And again, we needed to have culturally competent training for all hospital staff, including nurses and doctors, and then promote the field guide of LGBT councils, that the Joint Commission of Accreditation of Healthcare Certification, and so we're making sure that we disseminate all this information that exists. Since again, us as facilitators didn't know a lot of this information, so then we only assumed, and the youth told us they didn't even know this information existed. And the other issue that we sort of briefly talked about, and it's not really here, is about making sure that med schools, and there's a curriculum for med schools to start talking about LGBT issues to their students. There was one med student who just recently graduated in our session, and she mentioned that they only had maybe a one-day discussion on LGBT issues, and that was it. And most of the med school students sort of just came to the conversation, and the next day they just checked that afterwards. So there was no follow-up in terms of training the future doctors on these issues. And again, a lot of these doctors just sort of saw them as providers and not necessarily as follow-up with these issues. And then it's healthy food. So a lot of the youth talked about having access to healthy food. And so there was a campaign around de-shaming link card. Oftentimes youth specifically, the Center on House, that's right next to Whole Foods, so they have access to Whole Foods, and Whole Foods does take link card, but then once they step in there, they're often looked with, eyes, if they're being stared at, and when they do pay with their link card, the cashier register always, follows up with, are you paying with link card? Is this link card you're using? Are you paying with EBT? And so right there, they're already publicized and they're being shamed for using the EBT card at Whole Foods. And so Harlem Lions works with Vital Bridges, and they expanded Vital Bridges to homeless youth, dispense healthy food to youth at existing institutions on a daily basis. So oftentimes when youth go get their food, any other places, they usually give it PB&J sandwiches or food that was donated to the agencies from the night before. So this food is not always the most healthiest food, and youth they want fresh food, they want organic food. So how can they get access to that? There was a suggestion about creating job training programs for agriculture in all warehouses and gardening organic food farms, and so that obviously creates jobs in food. And so how do we move forward with that plan? Next slide. The next big thing that a lot of the youth, and this is a younger youth, that they really wanted, so there was sort of a divide between the older youth wanted access to healthcare, the younger youth, and again, they were tired of coming to the north side to Center on House from the burbs. And so so they're sending them on the metro to come to the city, and then once they're in the city, you find your way to Boys Town. And so the service providers didn't mean any harm in doing that, but they didn't have the resources in their own communities to sort of provide the services. And again, this is either LGBT, culturally sensitive healthcare needs, but also just safe spaces. And they don't exist. So, by creating safe spaces that they can have access to food, laundry, showers, bathrooms, storage, etc., outside of just social services. And again, providing opportunities for sports, dance, self-defense, and other programming that they really wanted. One of the suggestions that they should have pop-up spaces within Chicago Park District to have, come together as community members and really just share with one another as opposed to leaving their communities. One of the big issues that we talked about is expanding what Medicaid can cover. Most of the youth have not seen a dentist or an eye doctor in ages, if ever. So youth even shared their own teeth and how, they weren't really embarrassed of their teeth, but they're just saying, this is what not having access to a dentist looks like. And so, how can we advocate for that? And again, work on prevention, so the emergency fund to cover dental and vision co-payments and other non-covered expenses. A lot of youth don't know where to go to. Even in our discussion, one of the people had a different kind of service, a different agency with a lot of youth were excited that they could go to there. I think there was only one place that a lot of the youth knew about, and so they were even sharing information in the spaces. And also activate multiply clinics to provide dental and vision care throughout the year. And one example or recommendation is to create an LGBT community classroom donation program. So we can have all the gays in Boys Town donate glasses. I think that would be a great idea for all of the youth. HIV. It's interesting that a lot of youth didn't really talk about HIV and AIDS when we were having these discussions. It wasn't until maybe someone brought it up and then sort of the conversation went along, but that wasn't the biggest issue in our conversations. It was about other issues. But some of the few suggestions was everything needs to be a walk-in. They needs to expand the number of LGBTI and HIV, AIDS, and STI clinics throughout the city. And that would include testing and treatment in the same facility. Again, people only know the Center on Houston and Howard Brown, but where else can they go to in their own communities? They should have a sliding scale for STI testing and treatment in Howard Brown, focusing on prevention. Adherence to drug regime depends on housing and safe places to store drugs. And so we need to investigate how to integrate these services. We talked about the lack of information for transgender individuals, so then how can we find more data? And so we need to start collecting that data. And a big issue is providing non-judgmental, culturally competent, strength-based questions and treatments of sex workers. We can't deny that folks rely and result on the black underground market of the black economy, but it's happening, and so how are we making sure that we're being sensitive to those needs in that community? Mental health is a big issue, so youth are asking for mental health. They want to talk about the issue that they're going through. And the other thing is that they don't want to go to just caseworkers that see them as clients and that see them as a number. They want to go talk to individuals that are really invested in their success. One of the big issues that they want is that they want life coaches. They want to talk to people who have gone through similar issues as they're going through that look like them. And they want, again, long-term friendships and commitments, not just someone that they can go to for a day, have your evaluation, and then move over because you only have 30 minutes to talk to somebody. They want someone that really cares about them. They want to talk about spirituality. They want to talk about their spiritual health. They want to talk about the fact that they're being sleep deprived. So when they're going to community centers and they're telling them you can fall asleep here or you stop dozing off, what is that saying to them? You're not being responsible to the issues that I'm going through. Expand access to psychiatric and counseling for LGBTQ homeless youth. We need to sort of bring back harm reduction and substance abuse programs to Chicago. There's only a few programs that really have this model of the harm reduction, and so how do we expand harm reduction to other agencies throughout the city? How do we create a program or to pay for the medications that are not covered by county care? And that's it. Or any questions that, I'll see what's so we can try to sort of answer them together.
We'll try, okay. 15 minutes. Questions, thoughts, comments? Again, as someone who was co-facilitating with Lewis, I think the thing that really shocked me, I was planning on going into it, talking a lot about STIs, talking a lot about HIV, AIDS, and the first thing that was talked about was just wellness. They wanted access to gyms. They wanted to be able to work out. And they also wanted mentors to help with their mental health. They talked a lot about the mental and the spiritual aspect of health, and not a lot about their physical health necessarily, which I was surprised about.
Right. A lot of you talked about swimming classes, having access to bicycles, having access to some of these recreational activities that oftentimes we take for granted, but that's what they wanted. You know, they didn't want to talk about HIV/AIDS anymore. And if they did, it was because I have an issue. It's sort of just a part of who I am. It doesn't define me.
In other words, they want it to be youth.
Right.
Yeah, I just wanted to make a comment in regards to when you were talking about the hospitals and health. You know, education is a huge issue, and we need to educate the hospitals, the hospital staff, about making sure that our youth and anyone who goes to the hospital who is LGBT, that they are respected for who they are. I mean, I went to a hospital and they saw that my name was Laura, and they kept calling me a he and all that type of stuff. Finally, someone said in the room, they said, "Oh, do you prefer ma'am or sir?" I said, "Ma'am." And so I went back and I talked with the hospital administrator, and I said, "Look, you need to be more sensitive to people who come in. If they have a female name, you either call them by that female name or you ask them, how do you identify yourself? So that we maintain respect for the people, because lack of respect is what's going to get people on a downward spiral." So that's my only comment.
Thank you. That is very, very true. Again, one of the things that was brought up was about how do we begin to find ways to educate the medical students in training who don't necessarily know the language, don't necessarily know the questions, and are just being taught by people who also don't know. And it's like this continual cycle. So finding ways to quote unquote infiltrate the pedagogy, the medical pedagogy, so that this education can be happening, so we can begin changing that culture.
I really appreciated the contextual approach to the sleep deprivation for them related to mental health, physical activities related to mental health. As someone who works in research and program development and evaluation, we talk about there being a different federal funding. Well, that federal funding for us is coming from HIV/AIDS and very, very targeted. And so one of our struggles has been that how do we address that? How do we use that funding for that while also trying to address the real contextual needs of the youth?
You know, I think one of the things that, to connect from some of the other sessions was about looking at ways to tap into the private sector, not just the public, right? So if we know now that there's a concern, generally speaking, in which people want to work out, and we have all these great gyms that cater to the LGBTQ community, why can't we find voucher systems in which they'd be able to have a voucher to access those gyms so that they can begin to work out and perhaps even use the showers and be able to feel a lot more healthy and tap into their overall spiritual growth and health. So I think certainly looking towards the public sector is one route to go, but we have power within our community, and we have a lot of money within our community. There was a Washington Post story during the election last year that talked about the number of bundlers that President Obama had, and that the Washington Post reported 1 out of 6 identified as LGBTQ. 1 out of 6. That group of bundlers raised tens of millions of dollars. So it's not as if we don't have resources within ourselves outside of the private sector to address this as well. We need to continue to find creative ways in which that money that was used to help elect the president can help get these kids off the street.
Yeah. Just thinking about all these blue bikes around town. Has anybody thought of vouchers for those? I forget what they're even called. Divvy. Vouchers for those which do also physical health and transportation.
Absolutely. Yeah.
And are they in all of our neighborhoods? They're in Lakeview, but are they everywhere?
No.
So how do we get them in other neighborhoods?
I had a question about the dental and vision part of the section. My family has been one of those families that have been having trouble affording glasses and dental services. Is there a way? I know my little sister she's in the public school system and they do the free dental teeth cleanings and free glasses. Do you think we could get the organization to do that for the LGBT homeless youth?
I don't see why not.
I'm not sure if all kids covers dental and vision. I don't know if anyone knows about all kids, and so maybe they can talk about that. But in terms of agencies, you know, I think that's something that we can push for that to happen.
I know that starting on July 1st, County Care will be doing one free pair of glasses every 2 years, and then I think it's 2 cleanings a year. I need to like go back and refresh, but it doesn't start until July 1st, which is coming up soon. But Medicaid also covers stuff. I don't have it with me, but I have a list of like all the free clinics as well as the ones that accept Medicaid and County Care. Share that with you or with other folks. I think my question is maybe just like, I don't know, I think if, I work at the Broadway Youth Center as the youth health benefits counselor, so I enroll folks in healthcare and or I help them with linkage to care to PrEP and PEP, or working with our nurse for abortion or pregnancy care, I mean, and a whole gamut of things. And maybe just like talking with other people who do this job, like navigating healthcare. I mean, it's a beast. Like, there are so many different agencies that work together, and if you call this person for this thing, to get this thing done, they need you to call this other person that never answers, that you have to press the right amount of, like, number codes on my phone that I haven't memorized yet or something. And if there's just, I don't know if we're all, like, silo, just trying to figure out the system on our own, but if there's, like, a way for us to talk together about, like, how to make things happen quicker, like, it should not take me like 2 weeks to get someone to have an ultrasound who is 7 months pregnant. That should not happen.
Right.
And people should not be telling me to call somebody else, to call somebody else, to call somebody else, to tie my hands behind my back and jump through 7 hoops of fire, which I will do for you. So please come to me. I will do that. I will. But I don't know, you know, they're just kind of like trying to make so much stuff happen. It's, there's a way for our agencies to talk to each other about who our connections are, how you make certain things happen for people. And I think that we really need to capitalize on this moment of change where people are sort of arguing about what's going to happen with healthcare, and some people don't even know, you know, they're like, we're just kind of waiting, you know, like we need to tell people this is how it should be in this moment of change, and I think that we can figure out how to capitalize on that. We can really do some good things for each other.
Yeah, I mean, that's the issue that a lot of youth shared, is that they have the being sent from one person to the next person to the next person just to get their basic questions answered. Not even, this is just the question answer, right? Not even the services. And so they I don't know if they notice that we don't talk to each other as the service providers, but they were like, can you guys start talking to each other so that you guys can make it easier on us to get the services that we need, right? And they're not asking for a lot, they're asking for very basic services. Can I go get my teeth cleaned somewhere? Why did it take a million years for that to happen?
One of the barriers to mental health services, even if you have a program in place where there can be free or very low cost mental health services, is the whole traditional model of 50 to 55-minute hour sessions, 1 hour a week. And the challenge for homeless youth to be able to make that hour at that particular time once a week, and if you don't get it, then you don't get to see them again for another week. If you miss a few sessions, then you get dropped because then they need this. There's a big challenge with that model for homeless youth for mental health services.
Let's go here, and I think there are some hands over here.
Hi, my name is Jamie Fraser. I'm from the Lighthouse Church in Chicago, an LGBT affirming congregation. I sat in on 2 sessions of the health breakout group, and I constantly heard young folks talk about the importance of faith and spirituality. And one of the things that I would encourage providers to do is to reach out to LGBT affirming faith communities of various traditions and invite ministers, pastors to come in and to present a different faith narrative to them. So I wanted to recommend the Chicago Coalition of Welcoming Congregations. I think that there are a lot of affirming religious spaces in the city, but too often, because religion is such a touchy topic, we aren't called in. But I think there are lots of opportunities in terms of spiritual disciplines, as well as just teaching positive self-worth and value, that religious folks can come in, and there are a lot of affirming folks in this city. I think it helps with medical adherence. I think that it helps with a general sense of health and wellness. So a lot of times we're focused on HIV. Well, I have to actually care enough about myself to want to take medications, to want to get into care. And that's why I think spiritual communities can be very helpful.
There were two stories on faith really quickly. One is when a youth mentioned that they stopped going to church for that same reason, right? That the preacher was the one who was preaching against who you are. So they were just like, nope, I'm not going to go to any church anymore. I'm going to carry the faith in myself. Another person suggested that once they started turning to God and to some kind of accepting church, then they were able to think about themselves differently in a very positive light. And so, you have a very good point that the youth are not close to religion or faith, but they're looking for somewhere where they can turn that it's going to be healthy for them.
Two more.
Well, you set it up very nicely for my comment around the issue of spirituality. I was really interested in learning more about what the young people talked about in terms of their spiritual needs, because as we all know, many religious institutions cause significant harm to young people and to adults. And there are a lot of communities out there that are supporting our community in terms of the spiritual sense. And one of those is the Methodist Church. Lois Parr is obviously part of the Broadway United Methodist Church. There's also a Methodist church in Cicero. It's a small church, mostly senior citizens that have stepped up and taken a really active role in creating safe space for young people in spirituality. They funded us. We've hired 2 youth leaders, paying them to basically build a spirituality program for the city of Chicago. They've named it QYes, Queer Youth Exploring Spirituality. It's not connected to any religious denomination. It's just a safe space for young people to explore and heal what it means to be spiritual. And they funded us to do a 2-night overnight retreat in June for 15 young people to come. It doesn't cost anything, transportation, food, everything is covered. So I just want to point, there's a lot of really supportive people in church communities that are available for our young people, but I'd love to hear anything more. Their space is still available. If there are any young people here who would be interested in coming, or of a young person, you can either talk to me or you can look up QYes on Facebook. We have a Facebook page and you can register for the retreat there. But if there's anything more you'd want to elaborate about what young people said about spiritual health.
One of the things that was interesting, and this is just a trend that's affecting our culture, period, is that more and more young people are just not identifying with any religion or feeling the need to subscribe to any organized religion. But spirituality can be something as simple as a place to do yoga, a place to meditate, a place just to have peace and rest, where they can just have silence and not have to worry about the sounds of the city. And so spirituality, again, as it tends to be like a larger cultural narrative, specifically about the youth that we spoke with, it wasn't just about bricks and mortar, church and organized religion. It was about looking at spirituality from a holistic perspective, and what can we do, where can we tap into, where we can just sit and just have quiet and just peace to ourselves.
And the other issue is that the youth didn't expect that they're running away from any church, but rather they're so busy with everything else that they're going through that sort of religion is the back of their heads. It's like, yeah, I'm religious, or yeah, there's a God, but God has put me in this situation. So what's going on? We know what happens next. And so a lot of the youth said, God to me is just, I'm living God on my own, because that's sort of what they've been talking about.
And I would be remiss, I need to make sure we get this one statement out because it really struck me to my core. And that is, some of the youth talked about, again, the need for mentors and how they want to reach out to some of us adults who are doing so much in the community, but they feel that they can't because we're too busy doing things for the community. And so that really struck me as someone who's extremely busy. Knowing that you have young people who see us, who are proud of us, who want to talk to us, who want us for life coaches, but feel that we're running from one event to the next event, to the next activity, to the next activity, and thus we're inaccessible to them. That was also brought up in the conversation in terms of their health. I think there was one hand here, and then one more back here, and then you will be our last, because I got the evil eye.
I actually sat in on one of the health sessions, and I am in a homeless situation right now, and I want to say you guys did a great job of summarizing all of those bullet points come with stories, and there are children, and there are mothers connected to them, LGBT and otherwise. I'm sitting right here right now, and I'm a person who has chronic hypertension. I have a son who has a neurological brain disorder. He has a VP shunt for any pediatric neurologist in the room, and we are still pending Medicaid. And I came from a state, traveled here to safety, and I am still pending Medicaid. Had active Medicaid for him already, and we still don't qualify. I cannot answer to his school as to when he is going to see a doctor. He still can't participate in physical education, anything physical, until we have that. One of the other residents here, she was denied, just plain out denied. No one in the shelter has taken any interest. We're falling into this gray area of pending and those who are denied initially, and we have children who are in school with all of your children in this room as well. And I think that they also deserve an adequate shot at health care. So sometimes it's not always about, oh, well, she just doesn't want to work. We're not mothers who don't want to work and who don't want to pay for health insurance. However, there are those of us who really, truly, I've worked and earned a salary, and I still couldn't afford the pediatric care that's needed for my son's brain disorder. So Medicaid is something, and all kids, those are things that actually kind of help me cross that median. And I also wanted to say that when it comes down to mental health, domestic violence is something that creates a need. Like I said, all of those bullet points under healthcare, it's spilled over to the next sheet, because something like domestic violence is a crisis. It's a physical crisis. It's a mental crisis. And you need all of those. But all of those needs are not always met in-house at shelters that provide residency for us temporarily, but under that same umbrella where there are counselors coming in and out, where your donations and your tax deductible donations go, we're not getting those things in-house. I've been a resident for 5 weeks, and I have yet to see a counselor that has addressed my individual domestic violence situation. There are youth counselors, and my children have done several arts and crafts projects. I have an entire basket of them. I'm not sure how that's going to contribute to their mental well-being on riding the heels of a domestic violence situation like this. But again, I would like to commend you guys. I was in that session with you, and like I said, each one of those bullet points, it looks like, it's just a run-on sentence, but I'm about 85% of those. And these ladies that are with me here today, they represent that 85% as well. We contributed to that. So just to give you a face and a name, Tia Gold, I'm someone who is in those bullet points. So it is very important.
Thank you. And I encourage any practitioner who may have any suggestions or help or ideas to please reach out to this family. Clearly they're in a crisis situation. I think there was one more back here.
Just going back to the whole issue around concerns on spirituality, Eric Rice, who is a researcher at the University of Southern California School of Social Work, has done a lot of great work on the 5 indicators that lead to chronic youth homelessness. Then one of the top 5 is, interestingly enough, not being GLBTQ, but one of the top 5 is differences with parents over issues around spirituality and religion. He's done a lot of really great work around that. So if you're interested in that, just take a look. It's Eric Rice at the University of Southern California.
Thank you. And last time, yep.
I'm Lois Parr, Broadway United Methodist Church. We operate Youth Lounge and Youth Lounge 101. And if there's anybody here who wants to be a mentor, our Youth Lounge 101 program is 2 Saturdays a month, 2 hours on each of those Saturdays. It's small capacity, but it's youth driven, and the youth are telling us what they need. Do they need GED? Do they need a college app? Do they need scholarship application help? Do they need to write a paper? And so we're looking for one-on-one mentors for that program. If you want to be volunteer, I have lots of cards.
Great, thank you. Could you repeat the organization again?
Yeah, Broadway United Methodist Church. We're in Lakeview. We operate Youth Lounge and Youth Lounge 101.
Thank you very much, and thank you, Louis, very much.
And lastly, just want to conclude by saying, we talked about health, right? Because it's personal health, but the other issue that they briefly address is community health, right? So obviously we're the LGBT community, so you need to take care of one another. Thank you.
Absolutely. Thank you.